There are now 1.4 million displaced people in Lebanon, which is well over 20% of the population. In terms of percentage of population displaced, it's among the highest in the world because it's a small country. The displacement orders have also continued. Even though there was a ceasefire that was announced on the 17th of April that's still in place, hostilities have not ended. And we still get displacement orders every single day for different parts of Lebanon that people have to leave in a hurry. What this means is that for UNFPA that works on health and protection is that protection needs have risen exponentially. You've got women and girls who make up more than half of the displaced population, living in extremely vulnerable situations, on the streets, in their cars, in overcrowded shelters, in places that deepen their vulnerability and expose them to gender-based violence. We've also got 16,000 pregnant women among those displaced. Again, women who have lost the medical system that they knew and trusted, their doctors, their nurses, their midwives. What this means is that the escalation of the conflict in Lebanon has a direct and disproportionate impact on the women and girls we serve, particularly on their health and protection. The services that they had, which were already extremely limited in the south, were damaged. So they cannot get life-saving services there. Secondly, we have to understand that if healthcare is constantly under direct attack, people will not go and seek services. Women and girls will rather suffer at home, give birth in difficult situations, than risk going into a hospital that may be bombed. We're reaching both displaced people in shelters, on the streets, elsewhere, but also people who are still stuck in the south, which is under, daily airstrikes. But the mobile health clinics are basic services. If you still need to do a delivery, it needs to be in a hospital to ensure that you're truly safe. So while the mobile clinics are absolutely critical for us to reach people with basic healthcare services, with counseling, with referrals, for pregnant women that require to give birth, they still need the secondary healthcare service. So we also support them at the secondary healthcare level. But we're unable to do that if healthcare is under attack. If funding drops dramatically, we will have to start making impossible choices. Which are the centers we stop providing support to? Which are the hospitals that we can no longer support people at? The choices we make will have a direct impact on the women and girls. So I often tell people, don't think of it as funding a UN agency. Think of it as funding the women and girls who need that support every single day in the worst circumstances you can imagine. That is the impossible decision we're going to come up against if funding drops or is not sustained. Alongside the safety audit, we are also working with partners to do what we call an assessment, a rapid assessment. This is outside of shelters. This is where people are living in cars, on parks, on the beach, and we are saying, what are your protective or risk factors for gender-based violence. And the preliminary results are deeply, deeply alarming. We are only going to get the final results in another couple of weeks. But the preliminary results show that risk factors are not only high, but are growing every single day that people stay in a protracted displacement context.